So this presentation is about the impact of sickle cell. Had a number of presentations in different states, trying to bring knowledge. And this event is actually covered by our funders, Black community organization in Canada, giving us funds to help the also educate the entire Black community, not only Igbo youth. So this particular presentation is talking about people that have sickle cell. You know that sickle cell is not curable. You just present ideas on how you can manage it. Our doctor here, Dr. Emka Okolo, is our member of our community. He's going to use the example that we connected. He's not a white man, so only exactly how this works, so that those who have a sickle cell or have people have sickle cell can take this idea. There's so much experience. He's going to give you so much detail. I think we're going to have the maybe about
let me comment. In as much as it's a very important presentation, and indeed, our people will be very. This is prevalent sort of disease. But however, and if you are here about 5 o'clock, and if you have time now, if you can condense it. Okay, a manageable limit, like 15 minutes, because we did this in our own association. Only 15 minutes.
Okay, yeah.
I don't even just that time.
Yeah, I get your feedback.
Audience. I'm more now walking the local government area of the Enugu State. So you know, not wasting so much time. I'm going to discuss today the emphasis the causes we're going to want to how can we prevent them so we're going to use this outline, definition and the knowledge, the structural characteristics and chemical and physical complex, transmission from parents to hospital, by the genetics surrounding the disease, and then diagnostic tests, and the types of sickle cell, and how to present the clinical symptoms and signs, and how they are managed, and then data and conclusion, and then questions. I will try as much as possible to speak in English, but I'm not going to be teaching you. Sickle cell is a spectrum of diseases.
We can't hear you. Sorry.
You can't hear me?
Yes.
I lost my voice last night. Don't worry, we had something last night. So, yeah. So it's a sickle cell disease is a spectrum of diseases. Which means that from one end to the other, kind of in between. So, but the most important, the one I'm concerned about, the one now called calcium, which is the sickle cell anemia. That is the one that is more prevalent and causes a lot of trouble. So, the disease is typified by the appearance of C cells. In the human body, we have what we call red blood cells. Okay, the red blood cells normally, as we go along, I will show you pictures of normal red blood cells and the ones with the sickle red blood cells. So the name of sickle, the word sickle, is just like what you have in that instrument. You have a farm instrument. Most of you may be familiar with this instrument. You have fundamental rice and the other grain. So that's where the name of the comes from. So that's exactly how those cells, those red blood cells. I will show you pictures as we go along. So it affects all age groups. the highest incidence is among people from 6 months to 2 years. Now, when people are normally born with it, okay? But nature has a way of protecting kids. So, in that wise, the kids will have fetal hemoglobin. That even a kid will get out to be a sickler eventually during the person's life will not manifest, most likely not manifest anything within the first 5 months of birth because of the type of hemoglobin nature in the area, which we call fetal hemoglobin, BBF. So that's why the highest incidence now is from between 6 months and 2 years. That is when, but after that 5-6 months, the body, the child's body, because manufacturers, to produce normal hemoglobin. That is when those sickle cells will start coming off and not begin to cause problems. So that's why most people manifest with the signs and symptoms, which we'll discuss later, from the age of 6 months to about 2 years. So it affects people of every race, but it's a genetic, so it can affect everybody, both black and white. Now, schizophrenia is one of the world's most common human genetic diseases. About 200,000 babies born yearly with it. Most of them occurring in places like Nigeria, Congo, and Egypt. Eben large black population, basically. In the US, about 1 in African Americans now in the US, about 1 out of every 275 million are affected by this disorder. Then for Canada, in Canada we have a total of about 5,000 people diagnosed with living with this disease. So the life expectancy for anybody with sickle cell is kind of reduced from the normal somebody named ahead. So that's why most of them live up to about 54 years maximum. A lot of them, some die in between, but they can live up to that age. So it's about 20 years shorter than the normal life expectancy. Now, so as I said before, looking at this picture now, we are the normal red blood cells. Look at around, look at candy. Those are the normal red blood cells. Then the other ones go with that C kind of shape, with the sickle cells. So in a blood vessel now, which is a normal capillary now, the normal red blood cells, because they are normal, so they are able to function very well. They are able to change shape, they are able to carry as much oxygen as is required, as the body requires. And they are able to release those oxygen when they get to the vital tissues like the brain, the heart, and the organs. So as I said before, they are able to navigate their way through the blood vessels without causing any problem. Unlike what we have in sickle cell anemia, for someone that suffers from sickle cell anemia, you see those cells how they clump up together. Block up the flow of blood from one part from one end to the other. So that is the main genesis of the problem HANA cause. HANA cause so that disorder. And I'm just going to show you just a short video of to kind of plan the Anyway, I think I'm going to watch the movement of both normal and normal cells now. Now moving, kind of flowing. We have the 3D representation of what happens inside the body. You see now, if we go down, how do we get that form of block? You see the blocks they are forming now because they are not able to navigate those to change shape and navigate those smaller vessels.
A blood clot, known as a thrombus.
Okay, so now this is just when you look at the blood. When you look at the blood film, I guess we've outgrown the shroom. I guess we've outgrown the shroom. The formation of sickle cells and normal cells. So, coming to the causes now, as I said, it's a genetic disease. So, when people are born, let's look at this slide first. Now, this is how the gene is transmitted from parents to offspring. Now, you see, one is the man. Sorry, this all my daughter said. So this is the man and this is the woman. Okay, so the man go a carrier, which he has a AS genotype, and the woman also is a carrier. She also has AS genotype. Because it's only people that have AS and AS when they come together that can produce somebody. If any two people, one of the two people has AA, then the man, there's no chance of them giving birth to any one SS. You know, so it has to be AS and AS coming together. So and when they come together, you see that from the man gives the A gene to two kids and the S gene to 2 kids. The woman also does the same. So resulting in both of them now, there's a where AA, like the first child now on the left now, unaffected, all entered with AA. Then the second child, the AS, is a carrier. When you can lead a normal life. The other one, AS, the third child is AS. But the fourth child will SS. So what this means is that there's 1 in 4 child, 1 out of 4, a couple who do AS and AS, more may not. There's a chance of a 25% chance that one of them will be SS. It may happen that none of them will be at all. Even having go up to 10, none of them may be. But by probability, by mathematical calculation, we want to give a chance that one of them will be SS. So going back to this now, so that gene, Hannah, a parent passes to the kids. Now that's responsible for hemoglobin in the body. I got a hemoglobin in the a protein that has 4 subunits. Okay. Now it has each of them has what we call 2 alpha and 2 beta subunits. The main problem lies in the beta part of 1 or 2 of them, where one of the amino acids called valine is used to replace the normal one with glutamic acid. That's how much science has narrowed down the cause of this thing. So that is actually the major cause. The major cause of sickle cell is replacement of a normal amino acid with a different one on a globin or 1 or 2 globin chains. So because of the structural difference, as I said, and illustrated by the video and the Hannah, the cell, the sickle cell doesn't behave normally. Well, as I said before, it will not carry a lot of oxygen as the normal one does. It will not change its shape as the normal one does. You know, it will not, even the small oxygen only, it will not release it as the normal one does. So, and then it, because of its nature, it's able to come together and Nyacodon together, it's able to come together and form a blockage in the blood vessels. So, I don't know, so lower hemoglobin content in the sickle cell, okay, we don't know that's what I'm trying to explain. So, that now leads to starvation of oxygen to vital organs like the kidneys, the eyes, the brain, the spleen, leading to life-threatening consequences. So, it can cause kidney damage, it can cause blindness or poor vision, reduced vision, it can cause stroke in somebody where, and then it can lead to damage to the spleen, which will now predispose that person to a lot of infection. Anything just to program over there. Because the spleen is actually one of the lymphoid organs, the main lymphoid organ in the body that helps to capture and destroy microorganisms in a problem. So, and then it also has a shorter lifespan. Normal lifespan of a red blood cell, the normal red blood cell is about 120 days. Okay, so the abnormal cells have far shorter lifespan than the normal ones. So that now puts pressure on the bone marrow to keep trying to see if they can produce more and more, and then leads to some problems. So talking about the diagnostic tests that we normally do, the first one and the most common one is what we call hemoglobin electrophoresis. This one is actually done to any newborn baby in any hospital. Any new baby, that test has to be done on that baby to make sure the risk of sickle cell. Then the other ones are what they call high performance liquid chromatography. So then the presentation. Now, as I tried to say before, most of the symptoms manifest as a direct result of the abnormally shaped red blood cells. Their inability to perform their normal function and block the blood vessels and the organs of oxygen. So that leads to what we call crisis, which is the things that we're going to discuss further. So there are other things that can lead to the disease manifesting. That is, an infected person having crisis, which includes something like infection. As I said before, you have to be exposed to being infected by a lot of organisms. Low oxygen tension from strenuous exercises, so they don't have the ability to do strenuous exercises. Even going to high altitude areas, like a high altitude area, where low oxygen tension in them. So, like if you want to climb the mountain or go, anything that will take you very, very high, where it affects them. Then cold weather also affects them. Dehydration, if for any reason, like the person is not well hydrated, it can also lead to crisis. And then pregnancy also leads to crisis in some of them. Alcohol consumption, physical and psychological stress, and medical conditions such as diabetes. Now, so they can present with any of the following conditions, like fever, usually from infections. Then painful swelling of the hands and feet, what they call dactylitis. That's actually the most common presentation in infants. Their hands swell, and they have a lot of joint pains and things like that. Some of them are just some of them. We'll come to that. Then yellow discoloration of the eyes, that's jaundice, because of the increased destruction of those red blood cells. Then hematuria the passage of blood in urine. So in a mammary on that one, I know that they carry dark, darker than normal. Sometimes some blood particles in them. Then extreme tiredness, breathing problems, like difficulty breathing and you keep going out easily and things like that. Then priapism will prolong the erection due to that doesn't have anything to do with sexual desire. So it affects them, and it can actually lead to them having erectile dysfunction. So then poor vision, as I said, if the eye is affected. Heart failure, if the heart is affected. Leg ulcers, hepatomegaly just means enlargement of the liver. then lung damage, splenic sequestration, that is the destruction of the spleen, and kidney damage and osteoporosis. Osteoporosis is when the bone becomes brittle and fragile, and then that one can also cause some when you water like this, maybe the person will bend like this, because when those bones, especially the bones in our soul, when they're affected by osteoporosis, they kind of pull up some one another. If one maybe a short amount, so those are the small details. So then coming to management, the management basically starts from the prevention of having two people who are both careers coming together, and that is the only way you can remove the thing completely from happening. So that's by determining genotype of intending couple. There was a time in Nigeria some years back, and then before you go to any church to work, they will demand that you produce. It was a very good thing at that time to try and curtail the spread of this disease. Now, okay, as I mentioned before, in Canada here, they do this blood test, this hemoglobin electrophoresis, before to polio or something. So, but after you have made the diagnosis for people that are affected, what you do to help them depends mainly on what they present with. Like again, different age groups, like children, and some of the same concerns I mentioned before that are common in children. When they get common in adolescents, often they get common in adults. So that depending on what they present with, you can either use painkillers, like any painkiller. I'm not going to mention any particular give prophylactic antibiotics and injection. Actually, this particular one now, if they do this screening test, that screening test after find out that this sickle cell. That person, they normally start that person on antibiotics and the prophylactic antibiotics, and then even without the person having any evidence on the person at that thing, and then give the person some immunizations. There are some organisms that they call encapsulated organisms that are very very deal with the people who are this very much. So such children are immunized with vaccines that help to prevent those diseases, those organisms like Haemophilus influenza, strep pneumonia, and meningococcus pneumonia. And okay, so then another thing that are giving them is blood transfusion. Some of them are on regular blood transfusion, which also comes with its own complications for some. Then rehydration with fluids, especially people where bone crashes and people who are dehydrated. Then there's this medication they call hydroxyurea, which is actually a cancer medication. A medication that is used for people who are white blood cells, a form of white blood cell. But they are used in sickle cell patients because what they do, what that medication does is to the bone marrow now produce those fetal hemoglobin, even in adults. So it can be also used in managing the condition. And then bone marrow transplantation, even though that one is not very common because of the need to for you to find somebody match. You have to match the genetically that person, the person they receive with the donor. So it's usually not a very common thing that people do. But if you're able to get it done, it can give the person, make the person live very normal life for a prolonged period. Then also lifestyle management, such as frequent hand washing to prevent infection, basically drinking water as necessary, avoiding high altitudes and strenuous exercises. And then there are researches ongoing on stem cell transplant. Actually, on just this at the end of last month, October, the FDA, Food and Drug Administration, was supposed to approve a stem cell procedure, which have been tested and on populations. So that one is also something that can actually lead to a complete cure on somebody if it works out very well. As I said, there are a lot of them going on. Research is going on them. So coming to myths, misconceptions, and conclusion. So as I mentioned before, my hand about the phenomenon. So researchers has actually tried to prove that now this sickle cell disease behind our cause those things are not referred to as Obanje. But not everybody agrees to that. Then there's also victim blaming and shaming. Some people in our environment anyway, people take it out on people, blame people for something they don't have control over. Because I mean, nobody knew about these things then. So but we still see people doing these things, which we should all try to avoid and condemn if we see any of that happening. So then the need to educate and share information with our kit and kin to prevent having children with foodborne anemia and for those affected to seek proper medical intervention. So when anybody now they like somebody actually things like that. Just advise them to go and get genotype done. So we can start early to prevent and avoid for families that have this any child that has this condition, it's a lot of stress. It's a whole lot of stress. I mean, if you know any family that has it, if they tell you what they go through, you just have time to so and what else they avoid it, they should avoid it. Then anybody that needs more information, there's a very good resource, sicklecelldisease.org. If you go there, you can look at the researches that are ongoing. You can also donate to them. And I want to encourage people to donate to this cause because it is a very good cause that everybody should keep into, no matter what you have, because you never know who it will affect. And any donations you make there go a long way towards supporting the researches and studies being done. Lastly, we have every 19th of June every year is designated worldwide as Sickle Cell Day. So for creation of awareness and campaigns and things like that. So that is it, man. Thank you very much.
Thank you very much. That's very interesting, very enriching. Because as far as I know, this is a very a disease that has really taken a deep toll on our people, especially the black community. I was surprised when you were talking about that. The epidemiology. I wanted you to go back to that because the epidemiology is more on the blacks than the whites because of knowledge, because of behavior and belief system. I, for one, it was very difficult for me getting married. Actually, which I carriers, and I happened to be a carrier. And because I had the knowledge, before I started looking for a partner, I made sure that I got tested and got my wife tested before I married. So I want to ask a few questions. Number one, because you are into research, on this, the etiology of the disease has been narrowed down to, the sequencing of amino acids. Why is it difficult, to take care of this disease? Let's take, for instance, recently we just, came over, COVID. And part of the treatment we had was, the manufacturing of vaccines that we are synthesized. Why is it impossible to sequence or, redirect the sequencing of these amino acids to correct this genetic imbalance in human beings. That's number one. Number two, you were also telling us that the main, crisis that people have is, because, the sickle cell clump. And it looks like you were attributing that to, what I would call blockage of the blood system. Now, does it really cause blood clots, or is it because the cells change shape and are not able to transmit or transport oxygen to the tissues that require oxygen? What is really the problem that the sickle causes? Is it blood clotting, or just the deficiency in transporting oxygen?
Okay, I can start answering now. Okay,
Yes.
let me start from the last one. What it does is only to cause blockage. It doesn't cause blood clotting. They are not known to cause blood clotting. Okay, so but what they can do is, apart from coming together to narrow blood vessels and allow, maybe in some cases, complete cut off of blood supply, moving from the point where they ventilate, where they block. Or sometimes they can also interact with the walls of the blood vessels and get stuck there, and then maybe get dislodged over time and travel to the brain or to the heart to cause different kinds of problems. Okay, so they don't cause blood clot per se. Okay, that's one. Then coming to the issue of research. Now, as I said, I mentioned stem cell transplant. That's the thing that's closest to doing what you're talking about. Because why it is difficult to do what you're talking about is that, conception starts from union of a stem and an egg. And those stem and egg are already programmed with those genes. They already have those genes. So there's no way you can go and remove them from them, it's, maybe in future, somebody may come up with that, that gene on. But as it is now, there's no technology to actually do that right now. So, but with stem cell transplant, if they can remove the stem cells in the bone marrow, and infuse the stem cells that are normal, that don't have that got from maybe a donor or made in the lab, and infuse it on somebody, and then that will now start the process of making normal red blood cells. Yeah. Then, as I said, bone marrow transfusion is also another method of doing that. Yeah, but the thing is that if somebody that has the disease, if the person has the benefit of getting any of these treatments done, can lead a normal life. But if the person procreates, the child will still have the chance of having sickle cell disease. Because those things that are being done in the bone marrow do not have any way of affecting stem cells or the egg, as the case may be. Yeah. So, any other?
I just want to. It's only I know how to apply there because it's still.
Yes, yes,
Go ahead.
as I said, AS doesn't, anybody that AS will remain the normal life. Yeah, but they cannot marry SS or another AS. They shouldn't marry another AS. But they can marry, as I said, they can get married and have all their kids normal. But there's a 25% chance that 1 out of every 4 kids will have that disease.
Doctor, thank you very much for that wonderful presentation. Just to contribute to the question about sequencing.
Okay.
So there is a new technology being developed. It's called CRISPR-Cas9 technology. So you use it to edit DNAs. You can use the edit protein. So you can actually remove that particular amino acid and replace it with another one. So CRISPR-Cas9, you can Google it. That's a new technology. A lot of groups are working on that project right now. But as usual, given that it's a disease that affects blacks, so there isn't much funding, and there's not much funding into it, just like malaria, what they are doing with malaria. You get what I mean? So there is politics around it. But with CRISPR-Cas9, it can be fixed.
Thank you. And that's why we should all try and support the sickle cell disease report. Madam, you have some. Okay, madam.
Okay. Please, in the main, thank you all very much for coming up this evening. Sickle cell disease. Like I was hiding it for more than 16 years because I have a son with sickle cell disease. Due to the stigma, even my blood sisters and brothers, the same womb, I did not tell them that I have a child with sickle cell disease. Not until my son had kidney failure. Then in the hospital, there was nothing I can do. One day, my son just gave up on me, just like that. I was yelling in sick kids, and the nurses came. I was begging God. I said, God, if you save my life, if you save the life of my son, I will use the rest of my life to help children with sickle cell disease. I will not hide it anymore. I was kneeling down, begging God. God always answers my prayer. My son recovered from that kidney failure. Then another one, like from one problem to another. Most of the time, I always go to work from hospital to my workplace, from my workplace to home, from home to hospital. The worst part of it that happened to me, I'm just cutting it off because I know that we don't have enough time. Maybe in another seminar, I will tell you guys details about things that are happening. I want to tell you guys about this Comfort Smile. 1 second, okay? This name, Comfort Smile. Another thing happened. My son was given Advil. Then we had another kidney failure with the Advil. So I was running up and down, going from one place to another. The family, any family with sickle cell disease, is not easy for them. That's why anytime I'm out, I always enjoy myself dancing because it's not easy for me to come out. I'm so grateful anytime that I'm out. So my son was so sick, and in the school, the principal was asking me to come and pick up my children. So my children were late to be picked up. So I told the principal that I will pick up the children. I'm running late. I couldn't leave him in the hospital to come and pick up the 3 remaining. So after a while, I told the principal, Mrs. Saveras, I said, please, Andy is in the hospital. Could you please allow my kids to go home? Then the principal, Mrs. Sabrina, said, Comfort, why are you not telling me? I said, Mrs. Sabrina, please, I don't want to tell anybody. Please don't tell anybody that my son had sickle cell disease. So in the morning, I went to Mrs. Sabrina's with the results, because they always do the blood work every morning and night. So I went there with that blood work and showed it to Mrs. Sabrina's. Mrs. Sabrina's told me that, Comfort, Canadians don't laugh at people with sickle cell disease. Then that thing that she said rang bell in my ear. So we were just going. On my way going, I had the clothes that I, like when I get there, I'm going to clean up my son, I'm going to dress him up. The problem I had that time, the worst problem was my husband wasn't home. So I end up, that time was so, I don't know the word to describe it. So I got to the hospital. I saw my son because he had not taken shower for a while. They put like a wire here and there. So I used water just to rub him. I rubbed him everywhere. As soon as I cleaned him with that dress like up and down, my son just looked at the mirror and said, "Mom, I look like a doctor now." I'm like he smiled. So that thing, I said, comfort and smile. When you comfort a sick person, there will be smile. Like so that comfort, that thing that my son said, "Mom, I look like a doctor now." I said, comfort and smile. So I continue saying comfort and smile for children and families with sickle cell disease. That's how I got the name. I told my husband, I said, "Look at this name. What do you think? What do we do? What do we do?" He said, "We will use it." I said, "Okay." Then, on the day of discharge, we ran straight from the hospital to our elder, Ezekiel Eke. I told him, he was looking at me like this. "Are you telling me that your son has sickle cell all these years?" I said, "Yes, sir." I started tearing. And then he said, "Comfort, don't worry." So I gave him the name, gave him everything. He applied for this. Not up to 2 months, he told me that government of Canada has approved it as charity. Then we got a lawyer that went ahead to apply again, and then they gave us the number, charitable number. And this sickle cell organization is for Canada as a whole and Nigeria. Please, my brothers and sisters, this is a good cause. I'm begging all of you to help me out in doing this. All of us back home have relations that have sickle cell disease. And with the things that they are doing now, like the bone marrow thing, and so many things, they have already said what I want to say, the black people are suffering. We are helping ourselves. They are not paying too much attention to this. And now, if your wife is pregnant, they can check and see if that child has sickle cell or not. And they can do the magic and the wonders they are doing and take that sickle cell away from that child. I'm telling you, I don't say what I don't know. If your wife is pregnant, they are doing it now. The lady that has been working on this is Lily Johnson. She has been campaigning about the black people. So I know that I have to round up. Mary no be very can put you on all four very. I go mean no one with ala. So, I not do money insurance. So, oh no, Bula. Oh no, Bula. I don't want him to oh no, Bula. When I am with a sickle cell, or one day I'm with a sickle cell. Biko, take unam. Maba mobara, maba me. A chineke me na nyeze. Because if they will all reagi, Jikele chineke gi, ezu gloria gezu. Any oria is inwebe, ariaga, bayoshi. The problem shared is a problem half solved.
That's a don't ask, don't tell. Oh, yeah, the problem.
Every people are one, now they don't work in a one. They look at what keep them work. But the audio will even Koya, give audio Shiala. Mahini and the anime Joe Here, Nekele, in the executive. People Chineke ga go jila me no. Yeni no mega. O ga re no mo. Amen. Cherebla. Nu ga ne jeje na aba aba. Ogo mo na ga ko mo, kwa bara ga ko. I mean this from the heart of my heart. Yeni very aha. Makenne make behind the back. Chineke ga go jinu. Ahi me here. Ne ko ozo. Ne wana na eche na ozo. The last one. All right, don't die. Oh God, the last one.
Behind the bathroom.
Anne mena. Ihuna na chichana ke ma kola na o nwere mmapụ ụmụaka m enwere m ụmụ nwoke anọ ya rekwara dị mma ma kpọrọ nwojima swimming nge mega swimming imana shi ejimeje na ladies place ma jiba ba ma na abana lebo onye Chinese Jehovah Chineke ụmụaka mama mebe ngedoma nnu otu mama shi hey mommy look at this look at that now aga him kuge why or trying na go jiba chiko bunwo chinele pula nya nele pula anya no nele pula huna nyimgo ga no nwoke ọgarịrị gị mmọnwụ ọma nwoke ga-emeta odeme nwaanyị emeta odeme nwoke bụ isi ezinụlọ gị gbakwa nwoke okwu yara gị ahụ gị shicha nri gị kwuru the best part nye di gị yara kwara gị mma the best part nye digi ya bo the best part ikuru cha nye digi ya bo la gi cha
No women.
Thank you. Thank you. We don't know what's in there. One